lot of promises were made in the days following the massacre in Bondi Junction when a mentally ill, unmedicated homeless man killed 6 people with a knife. But 3 months on, where are the services that were promised and how much safer are we?
Do you fear we will learn nothing from these recent events?
I really fear we'll move on. We'll move on quickly. That when the tragedy passes, the next news story, the next crisis, the next problem will immediately dominate and the learnings will be lost.
People don't really know about mental health diagnosis, and people look at you sometimes suspiciously.
My glorious, loving, soft-hearted, hard-working daughter was murdered on April 13 while shopping for a birthday present for a child's party the next day. How ordinary.
Elizabeth Young's raw grief is hard to forget, speaking at her daughter Jade's funeral just days after the Bondi massacre. Schizophrenic Joel Couchy killed 6 people. He was diagnosed in his teens, but is believed to have been off his medication and living rough on the streets.
I want politicians, both federal and state, to address the gaps in mental health care to make it a safer world for our girls and all Australians.
But 3 months on, little has changed in our mental health system.
Mental health is really struggling in Australia, and it's really struggling at the hard end.
I mean, the main problem, I guess, with our mental health system is the lack of attention to the most seriously mentally ill.
I can't do nothing and I'm very upset.
Mariana Whitfield is another mother in anguish.
Where do you believe he's living at the moment?
In the street, in the park. Him say sometime go to the city.
And he wouldn't be taking his medication or?
No, at all, nothing.
Her 34-year-old son, Juan, was recently missing for 2 weeks. He was diagnosed with schizophrenia aged 19. It's a mother's job to worry, but her pain is overwhelming.
It's hard, isn't it, to worry, not know where he is?
And the biggest problem is trying to get help. So she's done everything, gone to the psychologist, gone to the doctors to get the help for him.
Mariana and her husband Ronnie say they've tried endlessly to get Juan help, but they say the system for those who are chronically mentally unwell is broken.
I think there needs to be more help in that particular area, constant help, not just, you know, here's something and see you later, goodbye. They need that constant supervision.
People are not born itinerant. People don't just choose to be itinerant. People become itinerant through disconnection.
Professor Ian Hickey is Health and Policy Director at the University of Sydney. Since the Bondi massacre, the New South Wales government has committed $111 million towards community mental health services to catch people before a psychiatric breakdown. But Professor Hickey says we need to go further with a hybrid housing healthcare model.
We actually do know what to do. We did it during COVID. We provided homes and healthcare together. Put the two together. If you put homes together with healthcare and people stay put in the one place, we can make a huge difference.
Places like that are few and far between. Earlier this year, Wesley Mission closed its 2 mental health hospitals in Sydney. 70 beds no longer available for those struggling with mental illness. Professor Hickey says we need to change the conversation around mental health treatment.
We have the community idea that you're only well when you quit, so I want to be like everyone else. We don't say to people taking insulin for diabetes or inhalers for their asthma or many other life-saving treatments that it's better if you quit. But people get told that every day of the week with regards to mental health and mental health treatments.
I don't claim to be a saint, I don't claim to be perfect, but over the last 40 years, I'm more closer to perfect than I was previously, you know.
Stephen Corey has lived with schizophrenia for 40 years. He considers himself one of the lucky ones. He has public housing and sees a doctor every 6 weeks at Sydney's Matthew Talbot Hostel, run by Vinnie's. Stephen's one example of how the system should work, but he knows he's an exception, not the norm.
If you didn't have the support that you have had over the years from the centre here, where do you think you would be?
Probably I wouldn't be alive if I didn't have public housing. Probably my mental health would be up all over the place if I survived from the possible fatal parts of the illness.
You know, I think if the funding went towards supported housing, you probably would save vast amounts of money.
Psychiatrist Dr Olav Nielsen has been seeing patients at Matthew Talbot Hostel for nearly 2 decades. He too believes it all starts with a place to call home.
The idea that you can discharge people and send them off to look after themselves once they've recovered is probably, you know, negligent.
Over the past 3 years, Vinnie's has seen an 88% increase in requests for homeless services. Last year, it had to turn away 47 requests for help each day from people experiencing homelessness.
There's evidence to show that being on the streets does add to trauma, a person's anxiety. It could bring out diagnoses that have been laying dormant. People under that type of pressure could then turn to drugs or alcohol to help them meet the reality of being on the streets, and that can further spiral their diagnoses.
Brett Macklin is acting executive director at Vinnie's. While it shocked him, the Bondi massacre didn't surprise him.
It could have been any number of our clients that would have been in the same situation. Long-term homeless, may have been disconnected from mental health.
People don't really know about mental health diagnosis, and they bundle people into the one lot. The stigma gets larger and people look at you sometimes suspiciously.
The New South Wales Government says it acted quickly after the tragedy to expand mental health services, and the details of the $111 million package are on our website. But there isn't any time frame on when the new services will become available.